This is Bill Sullivan, resident of Chelan County.
Yes, Bill.
Just want to get on record, make sure the board understands that there's another data set out there than some of what we've seen here. And, I'm not sure that the board is, in the meetings that I've seen, has completely considered some of these numbers. As you know, the PCR test has been reconsidered by the FDA. Currently, it looks like they're going to pull that in December of this year. And for the reason is that it does not distinguish between the COVID virus, the flu virus, and other viruses. And so some of these case numbers that we're seeing and hospitalization attributions are likely, including the PCR test that's currently being used, which is obviously inflating the data. The board probably understands that. I'd just like to see recognition of that kind of consideration at these meetings. Another one, for example, the VAERS data that you're all aware of, I think is somewhere around like 17,000 deaths associated with the vaccine now. And that has not been mentioned at these meetings that I can tell. Those are numbers that are reported by healthcare officials. And as you all know, they're widely known to be substantially underreported. This is now being brought up in front of Congress. And so I think it's worthy that our local elected officials can at least consider these numbers, before really kind of wholehandedly dealing with and just digesting and just kind of accepting the success story of our vaccine efficacy, safety, and vaccine rates that are occurring in our two counties.
Luke, have we had any reported deaths locally from the vaccine?
Currently, we have not had any locally reported deaths according to the vaccine or associated with the vaccine. Adverse events are something that we take very seriously in public health. And as we move forward, the VAERS that was mentioned is the Vaccine Adverse Event Reporting System. And it has been it was designed to be as transparent as possible. And so any health professional can put a report in there that can be seen by anyone. Now, those reports are not verified on the VAERS website. There is a process which CDC, FDA will go through, and they will verify every single one of those adverse events reports. As soon as it is reviewed, it is then sent, and that data is aggregated by the Federal Drug Administration and the CDC, and then assessed. So when, for example, this last spring, there was a rare blood clot that was associated with the Johnson & Johnson vaccine, that was picked up through VAERS. Just because it's reported on VAERS doesn't mean that there's a true association.